All right, we're gonna go ahead and get started. Thank you everybody for joining us this morning. My name is Grace Belangia. I'm the co-founder of Make Startups. We're a national organization. We started in 2012, and we're here to talk this morning with our team and our fellow members of the community about data and creativity and how does that work in the ecosystem and what you guys can learn from us. We're gonna talk for about 25 minutes or so, and then we'll open it up for Q&A. So if you have any questions, please hold them till the end. Right now, what we're doing is we're exploring how entrepreneurs and communities can blend analytical rigor with creative intuition to build the stronger ecosystems that we all want. And you may not think that creativity and data intermingle, but we're about to spend the next 45 minutes talking about that. What I'd like to do is go ahead and have both of my speakers talk about themselves for a minute, introduce them, who they are, what they're focusing on, and what excites them about data and creativity. Eric, would you like to start?
Sure. Hi, everybody. I'm Eric Parker, co-founder of Make Startups alongside Grace. And I guess for me, I've been in entrepreneur support for well over a decade now. And when I first got into the field, everything seemed to be really centered around celebrating the idea that an entrepreneur had. And there was like our entire focus seemed to be on how do we tell this story better. And to me, what's been really exciting, especially with the advent of artificial intelligence within our field, is the ability to take all of that sort of qualitative storytelling and turn it into quantitative data that can actually impact entrepreneurs and drive research forward around what we're doing. And so most of my efforts these days have been centered around how do we advance research in entrepreneurship by standardizing data collection practices in the field.
Bye.
Hi, good morning everyone. I'm Vahe Heboyan. I'm a professor of health economics and policy at Augusta University, formerly known as the Medical College of Georgia. I've been in academia most of my life. And over the last couple of years, my academic focus has started to gravitate towards entrepreneurial capacity building. And capacity building among students and capacity building among individuals that come from hardship, come from the challenging backgrounds where you can think about like the traditional job markets don't operate well for them. Again, you can think about the people in recovery and so on. And from the student perspective, I think one of the things that excites me about working with them as in this journey is about enabling them with certain tools that usually they don't get. Like one of the things I see, other than if you are in the business school, that's fine. But if you are outside of the business school, you are stuck. You might study medicine, you might study agriculture and so on, but nobody teaches you to be entrepreneurial. And we do know that some of the greatest inventions are because someone ended up being entrepreneurial. So that's one of the things I'm trying to kind of get our students to develop some of the skill sets that are needed for that.
Can everybody hear us okay? Okay, I just couldn't tell with the crowd behind us. Entrepreneurship often needs to move fluidly between our right brain creative storytelling and our left brain hard data. So let's start with how each of you applies that towards the balance of your work. I know that Make Startups supports founders with both a software platform and an evolving body of research. So how do you see the fusion of creativity and analytics playing out in the tools and narratives that help our founders, especially those that are trying to raise capital? Eric?
Sure. So the thing that's been really interesting for us is that when we actually built a system that measures whether entrepreneurs have gone through the market research process, they've gone through the customer discovery process, they've gone through all the different things that we tell them they should do in entrepreneur support, and we help them check against the sort of bias and love of their idea to make sure that there is a market need around it. What's been fascinating to discover is that we actually are beginning to be able to predict whether they can generate near-term revenue growth as a byproduct of that. And so that's really driven a lot of our work forward these days is, at this stage, we've done 10,000 evaluations of founders using our AI system. And so we have a 70% accuracy rate of predicting revenue growth as a byproduct of those evaluations. So now we're getting into a stage where the credentialing process that we use within our software is being adopted by early stage lenders, early stage investors. We're having conversations with states about using it to be an unlock mechanism for their SSBCI process. And so this way of getting an entrepreneur to actually, I always say, fall in love with their customer as much as they fall in love with their idea by using data to support that methodology, is opening up resources in ways that previously didn't exist.
Thank you. And Vahe, for your academic research, you've tackled public health and entrepreneurship. I know we've worked with you off and on for years. What role does integrative thinking play when linking these two different domains, like healthy outcomes and startups?
Well, that's an interesting. So when you think about these two domains, entrepreneurship, public health, you usually think, well, they have nothing in common, right? One is about getting people not to get sick or preventing diseases, improving health outcomes in the society, in our populations, the communities we live. Then the other one is more about innovation. It's about economies of scale. It's about the pace, right? It's a very fast-paced environment to go from idea to the products to the market or services to the market. But I think one of the things that I have witnessed is that even though public health challenges are many in terms of the underlying reasoning of why people get sick, why our communities are not as healthy as we want them to be, right? But one of the biggest, that's one of the realizations over the last several years, one of the biggest drivers of negative outcomes in public health domain is because of the economic hardship. Lots of individuals cannot go see their primary doctor. They don't keep up the appointments. They don't do the checkups. They don't do the regular annual tests or diagnostics simply because they don't have the means. Some work multiple jobs in the communities. They don't have the time to go and see their primary doctor, so things get undiagnosed, untreated. The next thing you know, it's already a very severe condition that takes more resources for treatment and so on. So again, economic hardship is one of the cores of in every community you go to when you think about adverse health outcomes. And one of the things that my team and my colleagues try to do is to bridge that gap through entrepreneurship. So I think this is where those two domains that we initially think that are very diverse from each other, they have nothing in common. This is where they intersect. This is where they come together, and that creates a value, creates an innovation where we bring entrepreneurial capacity into the communities where people have no other choice, right? Like lately, some of my work is among individuals who are in recovery from addiction, and for many of them, the traditional job markets don't work because of their history with the justice system or very fragmented resume and so on. They just cannot go and get the job that usually we think about, the job markets, right? So, and many of them are very talented. Many of them have hobbies or side hustles and so on. So I think that's where they intersect, and even that small amount of intersection, I think that creates a interesting innovation. So.
Thank you for that. I know in the past we've collaborated together. We did a Robert Wood Johnson study foundation on public health and innovation networks. What did the community participation look like, and how did it influence our findings? What was the intersection of how do you build that trust in relation to that research data for the community members to use?
Yeah, so the Robert Wood Johnson Foundation grant was really significant in our work overall. What we ended up doing at the early part of the study was using the methodology that they had established through countyhealthrankings.org. And if any of you haven't been to that website, I encourage you to check it out. But they've done a lot to identify how the social determinants of health are actually the key factors in what the health outcomes in communities are. And so our grant was really centered around how does the health of your entrepreneur ecosystem impact the health of your community through those social determinants of health. And so when we had every community that we were working with go through the process of identifying their own health pyramid, what we realized is every community's been heavily invested in the clinical care process. How can that be better? But the foundation, which was basically the the economic health of their community was tattered. And so that really led us to a place where we invested heavily as an organization in how to address entrepreneur support organizations being able to tap into workforce development dollars so they can help at-risk communities succeed. And through that, we ended up with a poverty calculator on our website that you can go to, and you can basically find out how many entrepreneurs in any county in America are facing poverty, what the total workforce development cost would be to support all of those entrepreneurs, and then what the economic impact of that work would be.
Thank you. Vahe, did you have anything that you wanted to add about the study that we worked on together?
Yeah, I think this was, that's the reason I ended up getting to know this person. Then I have a colleague of mine sitting in the back who was also instrumental in getting that project going. It was a really fun project. That's where I started actually to think about how entrepreneurship and public health can come together, or how can you bring entrepreneurship into our communities. And I think one of the things that I kind of learned about in that kind of exercise, I would call, is how do you engage the community? Because again, coming from academia, we sit in our silos and so on, and community engagement is a big thing, right? So there's lots of issues, lots of trust-related things, and it's just we are at the two different levels, right? So I think that project for me was very transformative in terms of better understanding the community, better understanding how to engage with them, and how to bring a change in the community.
Thank you for that. All right, let's talk a little bit about feedback loops and real-time adaptation. We want to dive into some real examples here. Something that we know that the entrepreneurs in your communities, as well as you as ecosystem builders, can both work on. I know that we have a platform, Co-Founder OS, that tracks founders' performance in real time, and it provides that tailored feedback. I'm curious, Eric, can you provide an example of where this responsiveness helped a program or a founder make a meaningful pivot? Because we know that that's what founders have to deal with.
Yeah, it's funny because I just feel like it's constant adaptation as opposed to pivots anymore. I think there's two founder stories that I think were really meaningful. One, we had an entrepreneur that was using the software that had recently got out of the prison system. And because of her experience, she was really focused on how does she create support programs and housing for people that are also transitioning out of incarceration and reentering society. And going through the software, what she began to realize when she started digging into the business model side and the financial projections was that as passionate as she was, it was frankly beyond her means at the time to achieve. But she had this side hustle going on where she was making custom t-shirts for church groups in the community. And using the software, she was able to ultimately pivot into turning that into a full-time business for herself, where she's been able to grow her revenues. And so that's ultimately leading her into the place where she's financially stable enough so that she can go into providing the transitionary housing in maybe another year or so as she continues to grow her business. And then the other one is we had a founder recently who went through the software. Honestly, they had an idea for building a software platform, no idea who their customer was going into it, and within about 2 weeks, they had overhauled their business model and ended up getting funding for their company so that they could move forward. So those were two really solid examples.
Thank you for that. And Vahe, I know now your work does include studying entrepreneurship as a recovery tool for those that are formerly incarcerated or maybe in the addiction space. How can this adaptive data system help those interventions become more effective and individualized for that community?
Well, as I mentioned at the beginning, lately, again, my academic work has pivoted to more focus on entrepreneurship in disadvantaged communities. And individuals in recovery from opioid use disorders, substance use disorders, are one of the focal points of what we do. The traditional approach to supporting the communities has been to enable them to have access to treatment, to have access to recovery tools, and so on. But as we started to work in the domain, one of the biggest things we realized is that, again, economic hardship is still something that prevents them from fully finishing the recovery or staying in the recovery and never relapsing and so on. So that's how we ended up trying to bring the entrepreneurship into this, right? Now, working with this particular community is different than from any other. So this is where the data and adaptations come into the place to better understand what are the unique challenges that are the specific community that we are talking about, the individuals in recovery are facing, and how can we adapt our approach to capacity building, enabling, to help them to become to succeed better. Because one thing we need to remember is that their experiences are quite different from mainstream population, right? Things that drive them, things that they need at this point in their life are going to be slightly different from what someone that has never experienced the hardship, has never experienced the adverse challenges, is going to need, right? So this is where, again, the data comes into the place to better understand the needs, the community we are serving. So that way also, again, going back to the earlier question about Robert Wood Johnson Foundation, I think one of the key aspects is to build the trust and to involve the community in this process. Because initially you show up from academia or from a big city and so on into these rural communities, and the first thing is that why are they here, right? So building the trust with them, you build the trust by understanding them, but showing them that I'm here to better understand what your needs are before I want to dive into and try to run a entrepreneurship capacity building training, right? So I think that's where we saw that data can become a powerful tool for us.
Thank you for that. I know that trust is big when you come into a community that you may not be familiar with, and so building that together with them is how you can get that success.
Especially with an accent coming to the rural Georgia.
Who is Vahe? I know a lot of times when we talk about data, we talk about historically what have we seen in the past. But the other thing that data does is it helps us with forecasting. It helps us with policy making. It helps us shape the future of our communities and the ones that we live in. And so now I know, along with our artificial intelligence and machine learning study, that we are helping to predict entrepreneur success. We're also researching how recent federal budget cuts have interplayed into that capital and how's it available for our communities of entrepreneurs. So what would you think, Eric, are the early signs that you're seeing and how these studies can help with this more equitable policy and maybe making those funding decisions more important for our communities?
Yeah, so I think like a lot of people in entrepreneur support, we have a lot of other things that we do as volunteers to try to help out. So one of the things that I do is I chair the policy committee for Startup Champions Network. And so we work with organizations from around the country that are trying to move the needle on local, state, and federal policy. And so one of the things earlier this year, we put out a summary of basically a policy roundup for everything that was accomplished in 2024 around entrepreneurship. But moving into 2025, obviously our landscape has been disrupted significantly. And what we're finding right now is if you rewind back to COVID, that was right about the time that we were making a lot of headway in how to address taking advantage of the workforce development system to support entrepreneurs. But at the same time, the entrepreneur support world was flooded with CARES Act funding and a number of other initiatives. And as a byproduct of that, most of our field ended up shifting towards, let's say, the easy money that existed there that is gone today. And so what we're finding is there's a number of organizations that are struggling around the country, and we're trying to quantify basically what is the impact to that on entrepreneurship communities. So how many entrepreneurs are you supporting in your community? Have you lost funding? What agency did you lose funding from? And how at risk are your services as an organization, so that we can then help identify what are the pathways of support that you need. Is it support at the local or state advocacy level, or is it support in how to address the private sector to support your programs? And then the other part of it that we've seen is a huge pivot back into interest into workforce development, because at the end of the day, the U.S. government hasn't touched that system, right? We had legislation reintroduced into Congress this year to amend the Workforce Innovation and Opportunity Act to improve the landscape for doing entrepreneur support in that space. And so in workforce, there's $10.5 billion a year that can go to our local communities to support your programs. So a big issue that we're trying to address right now is how do we impact your workforce plan at your local and state level so that your resources are aligned to support those entrepreneurs in your community.
And just for those that are here in the United States, the workforce program is something that is done domestically. I don't know if there's a comparable program globally, but for those of you that are in different states, every state has a different program, and that's one thing that I know that we've been working on for years. We're going to put up a slide in a minute that has some QR codes on it that'll help you get more information about the work that we're doing. And we also have some swag over here on the corner. I didn't have enough flyers for everybody, but there's certainly some information there that you can pick up as well. Before we close and open it up for Q&A, I wanted to know about the Institute stepping into this national leadership role on policy and research. And what do you see the vision is as the national conversation shifted? How are we defining the success, and what are we measuring? Because I know that was a conversation that was talked about a lot yesterday in terms of what ESOs are doing and not doing to sort of understand how we're making an impact in our communities.
Yeah, so we're actually partnering with Harvard and Stanford to work with ESOs from around the country and around the globe on identifying predictive markers of early stage success for startups. So if you'd like to participate in that study, we have a QR code here. Basically just fill that out and check that you're interested in research, and we'll reach out to you about ways to participate. But what we're finding is at the core, we took a very workforce development centric approach to entrepreneurship. So how do you address the underlying issues that workforce has to measure, which goes fundamentally to the idea of skills gains. And so we built a system that tracks how well entrepreneurs apply entrepreneurial skills into their business planning process. We track their ongoing behaviors, we track their social graph, and we track their financial data as a company. And so that's enabled us, going back to the feedback loops conversation, to build a really interesting feedback loop where we can apply machine learning to this data set so that we can both predict which entrepreneurs have a better chance of success, but then ultimately inform what the training models look like for every support organization moving forward. And so in this, we're able to ultimately track not only the entrepreneurs, but the direct economic impact of every program in a way that we weren't able to do before. And so that is what's moving the policy needle forward, is having actionable data about the programs.
Okay, thank you. I'm going to go ahead and open it up for Q&A. If there's anybody in the audience that wants to ask us any questions, either about the work that we're doing or anything about the QR codes that we've put up there. We figured this is the 21st century way of not having to print a bunch of flyers. So is there anybody in the audience here? I'm going to come down and bring you the microphone. Go ahead and state your name and your question.
Hi, my name's Doug. I'm curious if what's the source, what would you say is the source of starting out with a clean data set? If you have an idea and want to pursue it, what's the best way to make sure that you land something that's data that's clean if you don't have the technical chops to do it yourself?
It's hard to fully answer. So what we do is we help every startup build a data model about their own company, and that's our approach to it. And it's really centered around making sure that they understand who their customer is, that we gather the market research that they do about their business to inform what that data model is. And basically we embed the software along the way in their process. So their data set is as clean as the research that they do, but it's entirely focused on their business and not the broader market as a whole.
I think just to add on this one is sometimes you, depending on what are you looking for, there are data sets out there that have been cleaned, they've been properly vetted to contain accurate information. Like you can look into the government sources, like the U.S. Census, the Labor Department, right? The Commerce Department. All of them have market-related, business-related data sets that have been collected. They're representative of the communities that they are listing and so on. So that's where I'd also start to, again, go to more like a governmental sources as well.
Do you have a question?
Hey, good morning. Just a quick question on data sets. When it comes to factoring, can you talk about maybe some possible factors that AI model looks at to predict that 70%. I know that sometimes when you take certain factors into consideration, sometimes you might be leaving out other parts of the story. So just kind of wanted to know a little bit, if you can share.
Yeah, it's ever evolving because the challenge that you run into anytime you start to develop a predictive model is as soon as you tell people this is predict success, then they game for meeting those objectives. And so we're going to fight a never-ending battle on what that entails. And as a byproduct, we've actually developed 2 separate AI systems. So one is used for learning and training entrepreneurs, and one is now used for evaluating them. But at the core, our software was leading to a credential for the entrepreneurs, and we basically built that by working with a number of investors and banks around the nation to establish those standards. And what we discovered was that if an entrepreneur went through all of the efforts and obtained that credential, they had 70% likelihood to achieve near-term revenue growth over the first 90 days.
Here you go. Please state your name.
Good morning. I'm Denise Rodriguez from Puerto Rico. My question is, do you know of an example of anyone that has been to use workforce development WIOA funds for the work we do?
Yeah. So even specifically, so we started this to do that work, and we've certified over 100 entrepreneurs using workforce development dollars, primarily throughout the state of Georgia, but we're also working in Arizona right now to unlock their workforce development dollars. We've obtained state approval in North Carolina, Colorado, and Indiana, actually. So,
Georgia.
but we haven't actually seen funds deployed in those other states yet.
Was there a question over here?
Hi, Felipe from Michigan. I have a question about the AI and prediction model. 2 questions, actually. First is, what do you do to mitigate any kind of biases in the prediction accuracy, controlling for, I don't know, some kinds of factors that may influence entrepreneur success, such as gender, race, ethnicity, and so on? And second, is there any kind of adjustment for expected value where the upside of a given venture might be so high that even if a lower likelihood it would be worth funding? Thank you.
So to answer the first question, the software system doesn't know race, gender, anything like that. Now, you can pick up certain things by what somebody's trying to do and how they communicate, and we definitely work to try to mitigate against lower scores that might come just because of the way somebody communicates within the software. So what we're doing really under the hood in the initial evaluation of entrepreneurs is, if you think about it like in an academic way, you're going to have a certain set of criteria that somebody has to meet so that you know that they've done a task. And what we're measuring underneath the hood is the exact same thing. It's a very academic system that the AI is running the evaluation process for. And at this stage, I need to be really cautious in saying we have correlative data that supports the possibility of a predictive model. And the point of the study is to establish causal links between these things. So we're introducing random control trials within it, different types of information that we're sharing with different entrepreneurs along the way so that we can begin to understand, is there a particular piece within what we're measuring that is actually causal to it, or are we just happening to get lucky in a 70% marker? And sorry, can you remind me the second question?
Thank you. If there's any kind of adjustment or variable that's taken into account, the upside of the investment?
Yeah, that's so the way I would put it back to you is, there's certain startups that are going to be very, say, science research oriented, that are going to have a longer cycle before they generate revenue. And so those are actually skewing us lower, because even though those entrepreneurs might have identified their market accurately, they're still a year or more away from when they would grow revenues. And so that's going back to the study This is giving us the opportunity to do longitudinal tracking over 3 to 5 years instead of just doing it over 3 months, which is what we had been doing.
Just out of curiosity, how many of you in the audience are entrepreneur support organizers? Okay, hands up. All right, so this is just to reemphasize that what Eric is talking about in this study is that you can participate in this by sharing the entrepreneurs that you're working with, because those are the subject matters that we're trying to follow, the entrepreneurs in different communities, regardless of geography, industry, or demographics. And so obviously the more people that can partake in our research study, the more data that we can eventually share with all of you about what this model looks like. So just pay attention to the QR codes for sure. Another question?
You shouldn't have said that. 2 minutes. There's an outfit in the Pacific Northwest called Lightcast.io, and they have a software they call Gazelle that supposedly can predict growth companies. I haven't had a chance to look at it, but I would love to introduce you since they're from Idaho. The fun question is, when you do these kinds of studies, every once in a while there is a powerful predictor that nobody expected. So were there any big surprises when you were building your model?
The biggest surprise, which is what I really am trying to check against, is now my own confirmation bias that my thesis was that if we verified that entrepreneurs actually did the things that we tell them they're supposed to do in entrepreneur support, that they were more likely to succeed. And it's usually not that easy to prove something. And so it makes me a little cautious to see that all the early data was just spot on and reinforcing my core assumption.
All right, we're going to closing remarks for both of you, and then we'll step outside for a few minutes so they can get ready for the other room. We do have, again, want to reinforce, we have some flyers over here on the right-hand side, as well as some stickers. Can't come to a conference without stickers and swag. So please be sure to pick up one of those. But Vahe, do you have any closing remarks? And then I'll let Eric close.
Well, I guess my thoughts will be more like try to bridge the gap between things that have nothing in common, or at least that's what it looks like. So I think one of the greatest values that I have seen that is being created is when you intersect two domains that typically you don't see them having anything common. In this case, again, public health, entrepreneurship, and so on. So I think thinking outside of the box, bringing some creative thoughts into the process, and very importantly, get people from the other side get involved in the conversation, bring them to the tables. I think someone told me a couple of months ago about a question to ask yourself before you realize if everybody's at the table. Is like, who else needs to be at this table? I mean, we come with our ideas, with our thoughts, our education, our skill sets, and so on. But if we try to ask ourselves, who else should we bring to the table to have a conversation about solving a problem, I think that's where the biggest achievements are also found too. That's all.
Thank you. Thank you. Eric?
For me, it's we're really focused on growing the Make Startups Institute as a focused research institute on entrepreneur support and access to capital issues. And so knowing what our data collection impact tracking capabilities are looking like, or having a little bit better idea today. If there's a research study that you are fascinated with that our data can support, reach out. We'd love to figure out how we can partner with you on a study.
Thank you. Thank you very much. Thank you, everyone.